Fear hasn't been hard to come by in the UK of late. Fear of the virus, fear of going to hospital, fear that if you ended up there, doctors would be asked to choose between you and someone else for lack of beds, of ventilators, of drugs. But that is a fear which hasn't come to pass. Instead, the theatre of this outbreak has moved, appears to be moving every day. According to the data, it isn't hospital where perhaps the worst horror is taking place now. It's care homes.
Good afternoon and welcome to today's Downing Street press conference.
Today's government death figures included community fatalities for the first time, including care homes, and revised previous estimates for the last few months accordingly.
Those figures show that up to yesterday on the new measure, we have recorded an additional 3,811 deaths in total.
We can now include community deaths, but these are only if they've been tested. It therefore remains an underestimate, as testing in care homes is only being rolled out en masse now.
On the ground, people have been clear for some time that there's a problem in nursing homes. People have been coming and going in and out in the early part of March, so you can see the infection in there, particularly problems with protective equipment. So I think what you would have seen is that we've had this wider range of data sets, producing it on a daily basis. You would have seen this problem emerging much earlier.
If you feel we've been inundated with data in recent days, different data sets from different places, different time periods, you're right. But there is one way which we can look across countries and at our own: excess deaths.
I strongly believe that we should be looking at excess deaths. That's the number of deaths we observe from all causes compared with how many we would expect at this time of year. That's exactly how flu is assessed, seasonal flu.
When we look at our excess death figure, the picture is truly grim. England has the worst excess death rate in Europe, worse even than Italy. And unlike the rest of Europe, it doesn't appear to be decreasing again at the moment. We know part of this comes from care homes. Again, Newsnight's calculations show that care home deaths in England and Wales have skyrocketed in recent weeks. In week 16, 250% above normal. Even if you strip out COVID positive, they're still way above what's typical.
This is a message from the government. Coronavirus is a national emergency.
There's probably a reason for that. The government's campaign to get us to stay at home and stay away from hospitals has been too successful.
Out of the excess deaths that are occurring at the moment, roughly a quarter are not being attributed to COVID. And so there's other things going on. Now, it may be an underdiagnosis of COVID, but more worryingly, it may be, and I suspect this is the case, that many of them are due to the disruption of the health service. People are not going to hospitals, they're not getting treated, they're not calling the ambulance, A&Es have dropped enormously their attendance, and so on.
In recent days, ministers have had one thing they really wanted to talk about.
The first one was that we reinforced our NHS capacity through the Nightingale hospitals.
One of the reasons NHS capacity has always exceeded need is because of our amazing programme of NHS Nightingale hospitals.
That has protected our NHS capacity as we continue through the peak of this virus.
In other words, what these figures show is that the government's focus on hospital capacity isn't the only one we should be looking at. Ensuring that NHS capacity hasn't been breached has been something of a triumph, a real organisational and logistical feat. But it cannot be the only metric of success, especially if part of the reason why that capacity hasn't been breached is precisely because so many people have been dying at home, in the community, or in care homes, COVID and non-COVID alike. People who should have gone to hospital and they didn't, people perhaps in care homes who were kept away from hospitals. And as far as care homes are concerned, those early warning signs about what might happen were in place long ago.
That same success with which the NHS has handled the increase in coronavirus cases, there is now a question mark about, was enough care given to the care home sector? Care homes are full of older people, people with multiple health conditions that should already have been really flashing red is a high-risk area.
There is a long way to go. Success today could look like failure tomorrow and vice versa. For now, though, we do know that Britain's deaths are very high, both within hospital and most certainly outside too.